morning all. First of all, thank you the committee for giving the opportunity. I am going to discuss about the evaluation of microvascular changes and optic nerve head perfusion following trabeculectomy and optical coherence tomography angiography study. Glaucoma is a multifactorial optic neuropathy among which vascular theory makes hypothesize that vascular dysregulation can lead to derangement of optic nerve head perfusion and peripapillary retinal microvascular circulation. The changes at the microvascular level can be evaluated using OCT angiography. Optic nerve head angiography is done and the scan is taken with the area of 4.5 into 4.5 millimeter, and the software automatically fixes an ellipse to the optic disc margin with which we measure flux index and perivascular vessel density. Flux index or flow index is the number of blood vessels passing through the retinal vessel per cross-sectional area per unit time, and perivascular vessel density is described as the percentage area occupied by vessels in the area of interest. There are limited studies regarding how trabeculectomy changes the optic nerve perfusion and peripapillary microvasculature. So we proceeded with the aim of the study to determine the effect of trabeculectomy on peripapillary vessel density and optic nerve head perfusion in primary glaucoma patients using OCT angiography. So we included the patients in the range of 40 to 70 years with primary open angle glaucoma and primary angle closure glaucoma, and we excluded the patients who underwent prior cataract surgery with high refractive errors and patients with, who had undergone retinal surgeries and with media opacities in visual axis and who are unable to maintain fixation during the procedures, and best corrected visual acuity less than 6/18 and signal strength of OCT angiography less than 10, and patient with acute attack of angle closure, and patient with history of retinal pathology, and monocular patients and patients on systemic medications which affect the vasculature. So we calculated the sample size of 6 by taking reference with 12% precision and 95% confidence interval. The study is a prospective observational study, and we included 76 subjects who underwent trabeculectomy, and we have done OCT angio at first week preoperatively and on first, third and 6 month postoperative follow-ups, and we measured the changes in PVD, perfusion index and flux index. Coming to the results, peripapillary vessel density showed an significant improvement in the significant improvement at the end of the 6 month follow-up. As we can see in this image, both of the group, both pre-OAG and PACG group shows the increment in the PVD. Here we measured the sectoral PVD changes, superior, nasal, inferior and temporal PVD measurement also showing the same incremental effect. Then there was significant increase in the perfusion index in both the groups. Here we can see the structure RPC plot showing the increment in the peripapillary capillaries. So coming to the discussion, according to the vascular theory, the vascular dysregulation is responsible for the derangement of the perfusion of the optic nerve head and peripapillary retina. So OCT has the ability to demonstrate and to quantify the retinal and optic blood supply. So Jung et al. In their study demonstrated that there is reversal of microvasculature and structural parameters post-trabeculectomy in 25 patients. And Saho et al. Also demonstrated decreased optic nerve head perfusion due to high IOP, which can be reversed by reduction of IOP by trabeculectomy. Leo et al. Demonstrated that there was an improvement in retinal perfusion parameters after IOP lowering surgeries. We had few limitations like small sample size, and the patients included were more elderly, and OCT angio does not differentiate large vessels from small capillaries. And we came to a conclusion that OCT angiography demonstrated a significant improvement in peripapillary vessel density and optic nerve head perfusion after trabeculectomy in both POAG and PACG patients. And thus we concluded that OCT angiography is a promising technique that has potential to further enhance our understanding of ocular perfusion and may yield valuable insights into prognosis after surgery.